Left ventricular failure by nurse's note. Definition: a syndrome resulting from insufficient left ventricular output. Epidemiology: very common. Occurs in approximately 1% of people after age 75 and 2% after 80. Etiology: ischemic heart disease, hypertensive heart disease, aortic or mitral valve disease. Note that all of these are common, and so LVF is often due to a combination of two or more of these conditions. Pathogenesis: falling cardiac output triggers a drop in blood pressure. Low blood pressure stimulates baroreceptors and reduces renal blood flow. This leads to sympathetic overdrive and the activation of the renin-angiotensin-aldosterone system. Blood pressure is restored at the expense of an increased heart rate, increased peripheral vascular resistance afterload, and increased blood volume preload. Unfortunately, this short-term solution is deleterious in the long term as the work of the heart is increased even further. In response, the left ventricle undergoes hypertrophy, but this reduces the volume of ventricular cavity and lowers the stroke volume. Eventually, the heart becomes overloaded with blood and dilates. Presentation: breathlessness, fatigue, palpitations. Peripheral edema and ascites tend to occur in advanced disease. Macroscopy: the heart is heavy and the left ventricle is hypertrophic and dilated. The underlying cause may also be evident, e.g., coronary artery atherosclerosis or valvular disease. Histopathology: histology is nonspecific, usually showing patchy myocyte hypertrophy and interstitial fibrosis as a result of chronic injury to the chamber. Prognosis: poor prognosis, with many patients dying within 3 years of diagnosis. Associated with a poor quality of life and frequent hospital admissions. Fatal ventricular arrhythmias are a common cause of sudden death.